Hey guys, I'm Dr. Jeremy.
I'm Dr. Jessie.
We're from Sprouting Health Chiropractic Kinesiology. So sometimes we get asked by people, can chiropractic help after having surgery? Like we get a lot of people come in and say, oh, I've had neck surgery or back surgery, can you guys still do something? And there's actually some research that's now come out to answer that question. Now, clinically we see certain things, but we like to talk about what's in the research here as well, and that's what we're going to talk about today. So low back pain, and there's lots of research about this, is always recommended first step to be managed conservatively. And that might be chiropractic care or kinesiology or acupuncture or massage or physio. You should always try and manage it conservatively before going and getting deeper surgery. And there's so many studies that show that gives a long-term better outcome. But if you've already had surgery, can we still help? And I guess just worth mentioning here too that we know low back pain is one of the worst things globally that affects people's health. It's up there in the top couple of things that affects people's health in a really, really bad way. And the statistics are crazy about how many people get low back pain pretty regularly. So we're going to talk about some stats post-surgery. So we know there's a few things we can talk about here.
Yeah, about 20 to 40% of patients who actually went into surgery with this back pain hoping to get it managed and fixed. When they came out of surgery, they're still experiencing that back pain. And out of those people who had that back pain, that 20 to 40%, they went and sought chiropractic care after their surgery and actually saw some huge improvements. So in clinic, chiropractors such as Jeremy and myself, we can use these functional scores or index scores that kind of give people the same baseline. We can give people scores that are, graded against each other. And all of these people did these scores and found out that after their surgery and then seeking chiropractic care, their pain levels substantially decreased and they actually felt a lot better even after the back surgery, and the chiropractic care just improved it even more.
Yeah, so essentially, keep it really simple, exactly what you're referencing the study that Dr. Jessie just referenced. After surgery, they still had pain. The course of chiropractic care, the improvements that they measured were really good changes in terms of functional things like what they could do better in life and pain rating scales, which is really, really cool. Mm-hmm. So the answer to that, the question that we posed when we first started, can what we do, chiropractic care, help after surgery, still hasn't really worked great. And the studies that are coming out say yes. They're small studies. We need bigger studies to have more concrete answers on this. But so far, that's some really good signs. So if you know anyone, guys, that have had surgery and are worried, all the techniques we do here are really, really gentle, and we see lots of people like this. The studies are now showing, we can talk clinically what we see, which is really positive, but the studies are also showing that yes, we can help manage people that have had prior surgery and still have had low back pain.
And also it's really important to remember that prevention is the best thing. So you don't want to rely on things like surgery. Of course, if we have to get them, we can, but if you or anyone else you know has either had back pain and had this back surgery and they want to continue to improve, tell them to come on in. But also, if they're just experiencing back pain in general, we can prevent it from getting worse, hopefully.
Absolutely.
Yeah,
Absolutely. And there's lots of things that we can test to see if we can help someone like that. So good point. Even before you have surgery, if you've got any problems, come in and let us check them out.
Yeah. See you guys.
Thanks.